Good evening to all of you. So today we are again here for the next part of our Organon aphorisms. So last time we have done till 247. We have discussed that how we can achieve cure with a certain medicines by repeating them the way they have to be repeated in those special circumstances where they have to be repeated. Now we will go further with the other instructions regarding the dosage of the remedy. So we'll start with aphorism 248. So the dose of the same medicine may be repeated several times according to circumstances. So the dose of the medicine, it can be repeated several times depending upon the circumstances. Like we discussed last time, the circumstances, there is a general um, instructions given by Dr. Hahnemann in Organon regarding the circumstances, different circumstances. One of the example will come in the one of the aphorisms which we'll go through. There are general instructions given. The more certainty about the repetition, when to repeat, when not to repeat, when to hold, this comes from more of the experience. Once you start following these things, you will start experiencing different kind of experiences regarding your patients, regarding yourself also. Sometimes, for example, uh, you know, yesterday I had some experience because I was not well, so I have taken some medicine. So I will let you know at the end of our discussion, because the aphorism which we have to do regarding that thing, that we will do the next time. But still, I will share my experience at the end of the class. So all those experiences, they tell us that when to repeat, what kind of circumstances are going to require multiple doses, repetition of the doses, and what kind of circumstances will not require them. Okay. Regarding that, a general rule is given that until and unless the amelioration is going on, don't repeat the medicine. But only so long as until either the recovery ensues. But we have to only repeat until the recovery ensues, until the recovery starts. Once the recovery starts, then don't repeat it. Okay, in some cases you might need, like for example, very strong acute, you might need to repeat some doses, 1 2 3. But once the amelioration starts, you have to hold down on the doses, or you have to find a particular time period that the action of my medicine only lasts for this long. So I will keep that in mind and I will repeat accordingly. Or the same remedy ceases to do good. And the other circumstance where we have to stop repeating the doses, when the remedy ceases to do anything good. Okay, now the medicine is not giving any kind of amelioration, and the rest of the disease presenting a different group of symptoms demands a different homeopathic remedy. So once one when we have to stop repeating that dose is when the recovery ensues. First of all, when the recovery starts, and the second is when the remedy has stopped producing any kind of amelioration. Now that it has completed its action, whatever it could cure, that remedy, that particular remedy, it has already cured, and a different group of symptoms which are left, they demand a different homeopathic remedy. So we have to find a new homeopathic remedy for those group of symptoms, and then we have to give the dose. Every medicine prescribed for a case of disease which in the course of its action produces new and troublesome symptoms not appertaining to the disease to be cured is not capable of effecting real improvement and cannot be considered as homeopathically selected. If any medicine during its course of the action, it starts coming up, it starts producing some kind of new symptoms, and those symptoms are violent and troublesome, they are troubling the patient, then we know that that medicine is not a suitable medicine. Okay, this is also one of the Dr. Kent's observations, where he says that the new symptoms are coming up and they are getting very strong and they are troubling the patient, then that is the medicine which we cannot say that it is a homeopathic medicine. It has produced a change, but it has produced a bad change. It must therefore either, if the aggravation be considerable, be first partially neutralized as soon as possible by an antidote. So if the aggravation is very, very considerable, okay, it can also happen because of the large dose also. So we have to understand that part also. We have to conjoin that the older part. So if the aggravation is very bad, okay, then we have to antidote the remedy with some remedy which is basically according to the new symptoms which have come up, and we need to antidote it before giving the next remedy. Okay, so the first of all, the role of the antidote, we always think about, we have always studied about antidoting the remedy, antidoting. So the only role of the antidote is in these kind of cases. Many times some schools or some teachers, they say that before starting some kind of treatment you have to antidote the all the other remedies. It is not like that. Okay, antidote only comes when this kind of um, situation comes up, and mostly in some kind of emergencies or some kind of very strong acute diseases. Usually in chronic diseases you will not get this kind of scenario very commonly. Okay, but yes, in certain acutes or in certain emergency cases, Dr. Haneman will speak about that thing. So we have to understand that that is the only scenario when we have to antidote a dose. It is not a that some kind of law or principle that you have to antidote the effect of all the medicines which have been taken by the patient and then start the new one. It is not like that. So before giving the next remedy chosen more accurately according to the similarity of the action. So the next remedy then we have to choose after antidoting the symptoms. We have to choose the next remedy again according to the similarity. Or if the troublesome symptoms be not very violent, if the symptoms are not very violent, then the next remedy must be given immediately in order to change the remedy. Whichever you feel is the homeopathic to the symptoms which are there, then just give that remedy. If the symptoms are not violent, that remedy will take care of even the new symptoms which have come up. So we have to understand according to case, we have to change our approach. That is what the homeopathic physician understands. But there is not a one particular way. There are principles, there are set principles which I have to follow. But keeping me inside those principles, I have to be very flexible according to the case presented in front of me. This is the first thing as a homeopathic physician when we enter into the practice, what we have to do. We have to understand each and every case presented to us. That where does it fall? What is my approach going to be in this case? So whenever a patient is in front of us, whenever we have taken the case, whenever we have gone through the case, the first thing is to make an approach mentally. We select an approach that what I have to do first. Okay. So if it is a chronic disease, then we have to go according to that. If it is some acute disease, we have to go according to that. If there are some kind of aggravations, then we have to go according to that. So we have to keep changing our approach. We have to keep changing how we have to take up this case, how we have to take the similarity. Even in choosing the antidote, we will take the similarity of the symptoms. For example, certain new symptom comes, so we'll take those new symptoms, and we have to again find a similar symptoms. So we have to find a remedy similar to these symptoms so that it can antidote those symptoms. So that law of similarity is there, but what are we going to do in a certain case? So all these scenarios, all these aphorisms, all these examples, they tell us, they make up our mind that yes, in my practice, there are going to be different scenarios when the patients are coming to me. So I have to select out of all those scenarios what kind of approach I am going to take in that particular case. So that is why one approach will not be applicable to all the cases. Dr. Haneman started with that thing in aphorism 3, that in each and every case you have to perceive what is to be cured. That is the work of the physician. So that has been taken care right in the starting. And now this is the explanation of that aphorism, that how we have to adapt ourselves, according to the comprehensible principles, we have to adapt ourselves in each and every case. So footnote to aphorism 249. As all experience shows that the dose of the specially suited homeopathic medicine can scarcely be prepared too small to affect perceptible amelioration in the disease for which it is appropriate, we should act injudiciously and hurtfully were we when no improvement or some, though it be even slight aggravation ensues, to repeat or even increase the dose of the same medicine as is done in the old system. So Dr. Hahnemann is saying that homeopathic medicine, it can never be this small that it does not produce any effect if it is a suitable homeopathic medicine. So this footnote should be an explanation to the argument that the medicine did not work because might be I have given only a small dose. That is the case that my medicine has not worked. It has not worked because either it was not the simply that it was not the right medicine. That is why it has not worked. Okay, because Dr. Harriman very clearly says that homeopathic medicine can never be made so small. If you can just think that if homeopathic medicine can act just by inhalation, one small single inhalation, like last time we were taking that example, that if there is a sulfur disease which has been which is preventing the sulfur medicine to act, just take an inhalation of Merxol and that will take care of it. So just one single inhalation, if it can uh, cause the cure or it can affect a cure in a patient, then one globule or one small dose is too much, I think. Okay, so if we feel that no improvement is going on or there is very slight aggravation, and then Dr. Neman says that it will be injudicious on our part, it will be hurtful on our part, that if we repeat the medicine or give a more larger dose as is done in the old system. So in allopathic system it is done. For example, if a medicine of 25 mg or micro mg, it does not work, then the dose is increased, that this dose is not sufficient. But same is not true with homeopathy. That is not true with homeopathy. So when we are thinking about homeopathy, when we are practicing homeopathy, we have to remove the concept of quantity. The quantity does not work here. Either the medicine is right or it is wrong. If it works according to the way it should work, then it is a right remedy. Dr. Kent very beautifully says this thing in his philosophy, that the only way to understand that the medicine is homeopathic is that it will work. All the times it does not work, it was not a homeopathic medicine. Means it was not similar to the symptom. That is why it has not worked. So this is a simple rule. If the medicine does not work, it does not mean that your dose is too small or there might be some problem with the medicine or the dose. No, it's simple that the medicine is not right. We need to go back to our materia medica. We need to search for a new remedy which can be accurate, as is done in the old system under the delusion that it was not efficacious on the account of its small quantity. Okay, so we should, as homeopaths, we should not be part of this delusion that the medicine is not working because either I'm not repeating it or I'm not giving a large dose of it. It's too small dose. Every aggravation by the production of new symptoms when nothing untoward has occurred in the mental or physical regimen invariably proves unsuitableness on the part of the medicine formerly given in the case of disease before us, but never indicates that the dose has been too weak. So if there is any aggravation, any production, especially the production of new symptoms, aggravation by production of new symptoms. If aggravation of old symptoms is there, it's a good sign. We can wait. But not too much. If it is too much aggravation of the old symptom, that means your dose was too large. Okay. So if there is aggravation by the production of new symptoms, that only means that the medicine is unsuitable to this particular case, and it is not a weak dose. Okay, but the medicine was wrong. So we have to find a new remedy which can work in this particular case. So when to the observant practitioner who accurately investigates the state of the disease, it is evident in urgent cases after the lapse of only 6, 8 or 12 hours that he has made a bad selection in the medicine last given, in that the patient's state is growing perceptibly, however slight worse from hour to hour. By the occurrence of new symptoms and sufferings, it is not only allowable for him, but it is his duty to remedy his mistake. So, when an observant practitioner he is investigating into such case in the urgent cases, like the emergency cases or some very strong acute cases, when he is seeing that after the lapse of 6, 8, or 12 hours, that the medicine selection was wrong, the patient is getting growing perceptibly worse. He's getting worse. His state is not improving. He's getting more and more weak, and this can end into something which can be irreparable. Okay, so it is not only allowed, but it is the duty. So Dr. Animan says the duty of the physician, that practitioner, that he should remedy his mistake. He should make his mistake. He has already done a mistake and he should now correct it. How to correct it? By the selection and administration of homeopathic medicine, not merely tolerably suitable, but the most appropriate possible for the existing state of the disease. So it is the duty of the physician, even if we have done a mistake, to get that mistake right by giving a new medicine which is more appropriate, which is more similar to the state. Okay, so we as a physician, first we have to accept that yes, I have done a mistake somewhere. Okay, I was not careful, or I have sometime somewhere missed that thing, and I have made a mistake. And now let me remedy that mistake. Let me correct my mistake by giving a more suitable remedy for this existing disease. There are some medicines. Now, this is one of the exceptions which we have to remember. There are some medicines, for example, Ignitia, also Bryonia, Rus, and sometimes Belladonna. These four medicines, Ignitia, Bryonia, Rustox, and Belladonna, whose power of altering man's health consists chiefly in alternating actions. So they have this power when they are proved. When we see the action of Ignitia, Bryonia, Rus, Belladonna on a healthy human being, they produce alternating states. Okay, like diarrhea alternating with constipation, in the mood, sadness alternating with laughter. They have these kind of alternating actions on many spheres of the body. So that is their power. That is their power to cure. So kind of primary action symptoms that are in part opposed to each other. Okay. So when we give these kind of medicines, sometimes you see that the medicine does not act. It does not affect any cure. Should the practitioner find on prescribing one of these selected on strict homeopathic principle that no improvement follows, he will, in most cases, soon affect his object by giving, in acute diseases, even within a few hours, a fresh and equally small dose of the same medicine. Let us understand this thing. For example, a patient is suffering from diarrhea, very severe diarrhea, and once you have uh, gone through all the, you have taken all the characteristics, you have seen all this thing, and you come to this decision that I think Ignitia will suit this person, and you give a dose of Ignitia, and it does not cause any improvement. And in your mind, now you have a question mark whether my medicine is wrong or not wrong. So you see to it again that, and you're very sure somewhere that no, I think he is Ignitia. I don't think that any medicine will suit this particular case. So in these four medicines, there is strong alternating action. So what happens is that when you give a first dose, it usually in some cases it does not work. Some cases it does not work. Why? Because, and Dr. Hahnemann himself has said in his Materia Medica Pura, if you go to the Ignitia part in the Materia Medica Pura, that he said that I do not know for what reason, that we cannot say why it happens, but sometimes what happens is that Ignitia does not produce the similar state but the opposite state. Okay, it does not affect any cure because it goes to the other alternating state. And because the patient is in a state of diarrhea and it is working on the state of constipation, so it does not give a cure or relief to that particular symptom. But when we affect another dose, then it takes care of the other alternating action. You can just understand in that way. Then it acts on the other alternating action, that it will start acting on the diarrhea part and then it will start curing it. So it is only in these four medicines which he has mentioned this thing, not with the other medicine. So we just have to keep in mind that if it does not work, it will not happen always that you have to give it again and again and again. No. If it does not happen, then you can just repeat out dose of these four medicines. In my experience, it has only happened with me once with belladonna. And there was a case of very uh, chronic headaches which have been happening from a long time, episodes of headaches, and there used to be this cerebral congestion with high, very very high blood pressure. So just once it has happened with me, but all the other time all these medicines, they have worked as they were supposed to be. Okay, but yes, we have to keep this thing in mind, that sometimes because yes, that is the right thing. If the medicine does not work, you need to understand that the medicine is not right. But in these particular four medicines, maybe your first dose does not work, maybe. So it is okay to try once more, and if it does not work, then we will be very sure that the medicine is not right. If you want more good understanding, you can go to the Materia Medica Pura. You can read very small paragraphs, you can read very small paragraphs, and you can understand more about this thing. You can go with the Ignitia, you can the Materia Medica of Ignitia, and there he has written about this thing. Okay, so this is one of the exceptions from that part. But still, if the second dose is not working, then we will be sure that no, the remedy is not right and I have to find a new remedy. But should we find during the employment of the other medicines in chronic psoric diseases that the best selected homeopathic antisoric medicine in the suitable dose does not affect an improvement, this is a sure sign that the cause that keeps up the disease still persists, and that there is some circumstance in the mode of life of the patient or in the situation in which he is placed that must be removed in order that a permanent cure may ensue. So, in the chronic diseases, when you find a perfect remedy, you know that it is the right remedy. Okay. And that also we start knowing after experience, when we have cured certain amount of cases with certain amount of remedies, then we start understanding that no, the medicine is right, but somewhere I need to understand more about the circumstances of the patient, in what kind of environment he lives, what kind of things he consume, what kind of for example, one of my patients, I have been treating him from some time, and he's a hypochondriac patient. So I gave him some medicine and he started getting better. He was very good, very good, very good. And suddenly then there was this flare up. I gave the medicine again, and then again he started becoming better, better, better. And again, someday there was a flare up. So so now we have to, analyze whether it is amelioration and then aggravation, or the medicine is basically acting for a very small time, or there is some other reason. So when I went through, because as a homeopath we have to check the whole things, whether there's some mistake on my part or on the patient's part. We have to be very honest with ourselves if we want good results, if we want to do something good with homeopathy. So we have to be honest with ourselves. We have to be honest that okay, somewhere my medicine might not be. We have to be honest in the other way also, that there might be some problem with the circumstances of the patient. So with this particular patient, and nowadays it is a very common thing, all of you doctors, you will be facing this thing, that the patients, they go on the internet and they put the symptoms and some kind of disease will come up, and they get anxious about that thing. Recently, one of my staff members, she came to me that, sir, my father is getting this, there is this blackishness of the nails, and I'm very much panicked. It's okay, I have to, then what? Just show me the picture, and it was more like a fungal, this thing. It's a fungal. She said, no, sir, but I, on the internet, it said that it can be cancer. Because on the internet, everything ranges from simple inflammation to cancer. Any symptom you put, it can range from inflammation to cancer. So now that is also a circumstance, that is also a mode of life which we are used to in our today's world. So there we have to educate the patient that, the internet does not know everything. If you have any doubt, you can consult me. Don't go on the internet. And slowly he started understanding, and he has stopped now this thing. And now he's going towards more permanency of his health. So sometimes these kind of uh, obstacles to cure, they can be there. It is termed as the obstacle to cure, that although my medicine is right, although I have given in a very minute dose, but still somewhere the disease is still persisting. So we have to see whether they are consuming some kind of thing, whether they have some kind of habits, some problem in their diet, in the regimen, in the domestic or social relations of the patient, any problem in the job which is going on, which is keeping up this kind of disease. So 253 will start next time. We'll stop at 252. So regarding my experience, which I was talking about, so recently I had some congestion of the throat. And because next time we will be talking about this thing, 253 aphorism will be all about that, but still I am talking about this thing. So you can, after this class, you can go, if you want, you can go with the aphorism 253 and we will discuss. You can read what is written there. So recently I have been having very bad throat. Initially, I didn't wanted to take any kind of medication because I wanted it to heal on itself. But it was increasing. It increased to that um stage that now I was getting very bad pain in the throat, and it was not which I cannot. It was unbearable. And in my case, have I know that I have a strong this thing to bear the pain, because usually I ignore the to take the medicines for any small this thing. But this was very unbearable. I was having this very bad swelling and congestion in the throat, and it was all inflamed, and the pain was going up towards the jaw and down in the throat, and now it was advancing towards the right side. So I took one or two medicine. One medicine I took, one medicine Dr. Vidya she gave me, and I was not getting better. So then we both sat and we discussed some things, and we came to our decision that let's take this medicine. So one medicine was I took yesterday in the morning, and after taking it has experience. I have experienced this thing many times in the past also. Once I had a very bad diarrhea 2 or 3 years ago after this exposure to the cold, and then also I experienced the same thing. I took the medicine after, like I took the medicine and I was coming back to the room after taking the medicine from other room. 15 seconds, 10 to 15 seconds. And suddenly there was this feeling inside me, and I came to the room and I told Dr. Vidya that this is the right medicine. This one is right. Something in me in those 10-15 seconds, it suddenly changed. The thing which was unbearable for me, I started feeling in those 10-15 seconds that no, now it is bearable. A very good feeling came with that thing, that no, now the disease is not increasing. I'm feeling good, and it is going to subside. And after 1 or 2 hours, it decreased to 50%. Not 2 hours, but 1 hour. After 1 hour, even less than 1 hour, the whole swelling, that feeling, that pain, it all decreased to 50%. And by evening, it was completely gone. So those first 10-15 seconds, which I felt after that, that is the experience which is to remember, because aphorism 253 is all about that thing, that demeanor of the patient changing after the right medicine. The patient is themselves said, I am feeling better. I don't know symptom. My pain was not gone in those first 15-20 seconds. It was not that the pain was gone or the congestion decreased. No, it was still there. But something changed in me. That demeanor changed in me. That feeling of uneasiness changed, and I started feeling ease. So that is the part of the homeopathic medicine which is unique, and I have seen it happen so many times, not only on myself but on the patients. In the acutes, very quickly. In chronic diseases also, in few days, when the medicine is right, they will say that, doctor, we are feeling good. The first thing when you ask, how are you doing? I'm good. I am better. Yesterday I was talking to a patient who have been paralyzed from a long time, and she used to get tremors, and we have given her some medicine from past 2 months. That medicine we have given 2 months back, I think. And yesterday she talked, and I was like, okay, how are you doing? Doctor, I am feeling very good. This is the first thing which the patient will say when he starts getting better. The symptoms, they will come. I always ask about the symptoms later on. But the first thing which should come from the patient is that they start feeling good. They start feeling healthy after the medicine. That is a sign that the medicine is right. So next time we will talk about that in the aphorisms. We will talk about more examples. So you go through these symptoms regarding the dose, regarding the repetition. You can go to the Materia Medica Pura and just read that thing. It is not a difficult thing to read or understand. Just first few lines are there, and you will get a gist of aphorism 251, with what Dr. Hahnemann wants to say about that, those four remedies. And always be excited to experience homeopathy. That is the main thing. When it comes in the way of experience, then it starts settling inside you. Then you start enjoying it. You start enjoying the cure of the patients, your own cure also. We also need remedy. We are also human beings. So when you feel those things, when you feel those things happening with you, around you, with your patients, with your relatives, with your family members, then you start experiencing, no, this is something which should be done. This is something which I need to do in a more and more better way. And there is a very, very excellent guide for us. This book, Organon, written by Dr. Hahnemann, it is an excellent guide for us to tell how to have those kind of experiences, how to cure the patient, how to give the dose, how to select a remedy. Everything is written here. So with that, I will thank you all and see you next week.